Yes, sir, we are on live on Facebook.
Thank you, Sadiq Saab. Thank you. We're just waiting for our panelists to arrive. Arshad Saab.
Assalamu alaikum, I'm there.
Arshad Saab, assalamu alaikum. कैसे हैं आप सर?
जी अल्लाह का शुक्र है, आप बताएं सब खैरियत से हैं?
Allah has been extremely kind, sir. We are really excited. We are just waiting for Dr. Mahipala.
Okay.
I think he'll be joining us shortly. Dr. Rehana is already here. And
Assalamu alaikum, ji.
Sir, how is Islamabad?
Islamabad, ji, just changing the temperature every single day. एक दिन बारिश होती है, दूसरा दिन it's quite sunny. Interesting, like Islamabad mood, you understand? जिस तरह कैपिटल का मूड चेंज होता है, इसी तरह क्लाइमेट चेंज होता है.
ये जन्नत में रहते हैं सर आप, क्योंकि कराची में सिर्फ दो ही मौसम है, गर्मी और बहुत गर्मी.
बहुत खूब.
नहीं, लेकिन आप कराची की हवा भूल रहे हैं, सी ब्रीज.
बिल्कुल डॉक्टर साहब, शाम के वक्त हम पे जब सारा दिन जो सूरत हमें बिल्कुल तपा चुका होता है, तो अल्लाह में हम शाम में मेहरबान हो जाते हैं, क्योंकि बड़ा रिफ्यूज है उससे.
तो आजकल कैसा मौसम चल रहा है?
आजकल यहाँ पे गर्मी और बहुत गर्मी.
अच्छा, क्या है एवरेज टेम्परेचर, क्या चल रहा है?
35 से अब मरकरी और ऊपर गई है, 40 तक तो आ जाता है. I think we have been joined by Dr. Palita. Hello, Dr. Saab. How are you, sir?
Good, good. Thank you so much.
Fantastic. And since the quorum is complete, and we will be joined by First Lady just before the last speaker deliberates. So if we have permission from all of my respected panelists, can I start now?
Yes, please do.
Yeah, sure.
Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatam min lisani yafqahu qawli. Ladies and gentlemen, assalamu alaikum and a very good evening to all of you. On behalf of Greenstar Social Marketing, I welcome you all to this webinar, which is currently going on live on the Facebook. Now, as we are aware that World Health Day, 7th April, Greenstar Social Marketing stands with WHO, World Health Organization, which declared it this year's theme to be building a fairer and healthier world. एक ज़्यादा इंसाफ से सेहत देने वाली और सेहतमंद दुनिया की तरफ कदम उठाएंगे. मैं अंग्रेजी उर्दू, I will be bilingual because we are joined by a lot of service providers who have joined us on our Facebook channel. So we are bringing you today some of the most esteemed speakers from around the country and from globe. A call for building fairer and healthier Pakistan. But you know, Hazrat, this COVID-19 may expose a lot of inequalities that determined health and life outcomes depending on socioeconomic status and geographies within Pakistan. But it also highlighted for us the resilience of the community and primary health system that exists in this country across Pakistan. Now, it is up to the global and national leaders to find solutions to guarantee that every Pakistani has access to quality healthcare, including reproductive healthcare, mental health, and health support system. She breathes clean air and drinks clean water, has access to good nutrition, ग़िज़ाइयत से भरपूर खाना मिले और एक ऐसे environment में काम करे जहाँ वो safe feel करे and free from violence. Now this brings me to another point, that why is Greenstar holding this this session today with this elite panelist? So we are aware that 70% of the population in Pakistan accesses the private sector service providers in the time of need. This was shown recently when COVID struck Pakistan. A lot of service providers remained open while there were a lot of public sector closures across Pakistan to follow the SOPs. In these situations, during these pandemic days, when there was first and second waves, the private sector service provider or healthcare proved to be a first-line defense mechanism for the community. So, as Greenstar has a network which is deeply entrenched in the communities, this can be one-stop solutions, and which makes their existence in the community, make them resilient against the health challenges, and they can play a vital role in reducing the health burden. We have also been working for the last 30 years, Shana Bashana Hukumat ke saath, in several areas, maternal health, child health, family planning, communicable diseases, HIV, AIDS, recently breast cancer awareness, early detection, nutrition, COVID-19, and we are trusted by the government and the international donors that we have been working with. The community level changes, and for the primary care through a network of service providers, 140,000 outlets across Pakistan and 35,000 pharmacies and chemists that exist. Now, today, this elite panel will help us give us reflections. We will hear from the WHO about, number one, what needs to be done in Pakistan to ensure this fairer and healthier system, what has worked across the world, and what more is to be done. So we have our esteemed speaker from the WHO, and we are really grateful, sir, that you are here with us. We will hear from the government, Ashish Saab is here, how they are ensuring equitable access to health. कैसे सब लोगों के लिए सेहत for all, हर सेहत सबके लिए वो ensure कर रहे हैं. And how does the government see the role of private sector and companies like Greenstar? हम क्या और कर सकते हैं government का कि शाना बशाना इस काम को हल्का करें. फिर हमारे पास Greenstar से representative हैं. I'll introduce my speakers when I call them for their deliberations. We have from Greenstar, and Greenstar will tell us how it can contribute further to WHO's Fairer Pakistan concept campaign and work alongside the government. And finally, to wrap it up, we are really grateful that we will be joined by the First Lady, Honorable Samina Alvi Sahiba herself. What inspires her to bring about a change, and what are the learnings from her campaign on the breast cancer that we did across country? And she chose Greenstar to run this campaign for her. And what would be her guidelines for the government and the private sector to ensure fair access to health, particularly women and girls. Now, let me introduce my first speaker, Dr. Paleka Maipala, who is the head of WHO Mission. Dr. Maipala has graduated, he's graduated from in medicine and surgery from University of Sri Lanka in 1983, postgraduate in community medicine from Institute of Medicine's University of Colombo. He's also a doctor of medicine in medical administration and masters of business administration. He's also a fellow of College of Medical Administrators, Sri Lanka. He has served Sri Lanka at various levels, Director, Tertiary Care Services, Deputy General Health Services, Director General of Health Services. So Dr. Maipala will be bringing to us a very diversified experience in the fields of family planning, health, population, community health development, IDPs, rehabilitation, primary, eye care health services, and hospital development and administration. He's also been a member of Global Fund in 2012 and 13. I would like to begin with you, Dr. Saab. Welcome to our webinar, sir. And I have broken my questions in two parts. First of all, the WHO Day is calling for action for countries like us to take actions to eliminate the health inequalities as a part of a year-long global campaign to bring people together to build a fairer and healthier world and in Pakistan. So, sir, my first question would be, could you kindly describe for us and our audience what is meant by fairer and healthier world? Over to you, sir.
Thank you so much. Thank you so much for the kind words, distinguished participants, esteemed colleagues, ladies and gentlemen. It's my great honor, privilege, and I'm delighted to join you today to participate for this wonderful discussion. And I'm very much delighted to see that First Lady herself is participating, which shows the highest level commitment of the government, and that's amazing to observe and witness. The World Health Day is commemorated each year on 7th of April, which has a long history. It was started in 1950, and World Health Organization established, and the Constitution was ratified by member states on 7th of April 1948. That was the reason in World Health Assembly in 1948 decided that there should be a World Health Day, and it was decided 7th of April should be the date. So that this is the history. And each year, World Health Organization identified a specific topic to discuss, which is a globally important topic. And World Health Day this year is being commemorated under the theme of building, as you said, fairer and healthier world, and calling to everyone to participate to this great endeavor. So calling leaders, policymakers, governments, and everybody on the planet to come and contribute to ensure healthier and fairer world. So that's the theme. And let me at the outset admire the efforts of government of Pakistan toward the state of welfare. And the present government was talking about state of welfare. And I am from a country where in 1930s it was discussed the importance of state of welfare and decided the free education, free health, and social services as three most important interventions since 1930s. And that has given dividends. And today you see the life expectancy 80 years for female, and IMR 6 per 1,000 live births, and maternal mortality 0.28. You know, I can go on so on and so forth. The good, very good health indicators. And the basis of that was, you know, declaring Sri Lanka or my country as state of welfare. So that's very important. And I'm extremely happy and delighted to see that government is focusing on state of welfare, which talk about health services and education and other social sector interventions. So our world is an unequal one. As COVID has highlighted, some people are able to live healthier lives and have better access to health services than others. It's a truth. Entirely due to conditions in which they are born, grow, live, and work, and also age. All over the world, some people struggle to make with little day income, have proper housing and education, fewer employment opportunities, have little or no access to clean water, safe environment, food security, and quality health services. So if you really look at these factors, it's not only health, it's beyond health. And we need to look at the holistic view of this and how we can have a holistic approach to this. So this leads to unnecessary suffering, avoidable illness, and premature deaths. It harms our societies and economies. So therefore, ladies and gentlemen, we need to focus on this. The COVID-19 pandemic has exposed inequalities between countries more than ever. And the low-income countries have been pushed to the back of the queue in access to COVID-19 test kits, personal protective equipment. I think we all have experienced this. And also now the vaccines. If you go by the vaccine coverage globally, by last Friday, it was 536 million people have been vaccinated using COVID vaccine. And worldwide, by 76% of this was administered in 10 countries, and 27% were administered in one country. You can see the inequity, and most of the countries still waiting to have access to COVID vaccines. To improve this situation, we need to act on the social and economic determinants of health perspective. By working across sectors to improve living and working conditions and access to education, particularly for the most marginalized groups. Health and education are two most important interventions you need to focus. If you only focus on health, that will not give much dividends unless you focus education, which gives out literacy. And literacy in general and health literacy in particular is two important areas to be focused. Investment is also needed to accelerate progress toward universal health coverage. And universal health coverage is one of the areas we have discussed under the World Health Day few years back. And it is the area where we really need to focus if you really want to build a healthier and fairer world. Now, government of Pakistan has focused much on this and came out with the Essential Health Service Benefit Package to improve the primary healthcare services in order to reach universal health coverage. So we really appreciate and admire this initiative by the government of Pakistan. And also one of the iniquity we see in the country is deployment of human resources. It's a common issue. So WHO has supported development of human resource for health vision at the national level and also strategies at the provincial level. Implementation of this vision document and the strategies is very important at all levels. And WHO is currently supporting the Ministry of Health to implement the insurance scheme for outdoor patients in general. The insurance scheme, the Sehat Sahulat program, is mainly focused on indoor patients, but we need to really focus on outdoor as well. So we are doing a pilot project to see whether it is feasible so that we can really have a good coverage. So we are focusing one end to improve the primary healthcare services to achieve the universal health coverage, then to address the marginalized population to the health insurance system. I think this is an amazing example. And Pakistan, in the history, first country developed a universal health coverage benefit package using disease control 3 priority. So I think this experience will be useful not only to Pakistan, not only to the region, but also to the global community. Now, as we all experience, COVID-19 has taught us that it is not always possible to access health services at the health facility level. Hence, we need to scale up innovative ways, innovative interventions to ensure the entire population get the health services. So technology comes in handy in this case through the use of e-health. And e-health is another initiative of WHO. We came out with a document for 2024 e-health initiative. And government of Pakistan now already initiated, supported by WHO, the telemedicine, teleconsultation, which goes beyond the facility to the community. So we need to think about such innovative approaches to ensure that everybody will have access to health. And beyond health, we need to think about all the other social determinants like clean water, education, and so on and so forth. I can talk, in length, but these are the, important areas to be focused if you want to build a fairer and healthier world. I'll stop here.
Well, that was absolutely a very intensive dosage of a lot of wonderful things around the innovations that we can do and learn from the regional model. Thank you, Dr. Maipala. We have now the honor of being joined by Honorable Begum Samina Arif Alvi Sahiba. Madam, Assalamu alaikum. Very quickly, I would like to, as you all know, Begum Sahiba has launched and spearheaded the breast cancer campaign across Pakistan. And she has been playing very active role in creating awareness among the masses about the disease. She is also a very strong advocate of equal opportunities for persons living with disabilities. So, Madam, welcome to this webinar. We are extremely honored. And Dr. Maipala has simply, given us a very comprehensive understanding of the slogan of the theme, Fairer and Healthier Pakistan, given us a perspective of what has been achieved in the rest of the world and what are some of the very specific actions that Pakistan's leadership can take to ensure that all people are able to access quality health services, apni needs or values ke hisab se. So thank you, madam. With your permission, I will now invite our government representative, Mohammad Arshad Saab. Arshad is the director of Prime Minister Health Program, Sehat Sahulat ka jo program Government of Pakistan ne. First of all, sir, Dr. Mahipala has very kindly elaborated, alluded to the wonderful initiatives, because it took 70 years for maternal mortality and child mortality to find a place in any premier's opening address. And the government and the presidency has never looked behind from that point onwards. So we are moving in that direction. And then if this acknowledgement from WHO, I think it's something to be really proud of. So we would like, sir, now that you are heading this program and Qawmi Sehat Sahulat Card at the Ministry of Health with Government of Pakistan, I've got two questions. In the light and the backdrop of this theme that the campaign is going to run across the whole month probably and across Pakistan, what are the some steps government is taken to address health inequalities? सेहत सबके लिए हुकूमत क्या इक़दाम उठा रही है? और मैं आप लोगों की परमिशन से मैं बाइलिंगुअल हूँगा क्योंकि इस वक्त ये प्रोग्राम पूरे पाकिस्तान के सर्विस प्रोवाइडर्स और जीपीज दे आर ऑनलाइन एंड दे विल रियली बी मोटिवेटेड टू हियर फ्रॉम यू. सो आप मुझे इजाजत दीजिएगा कि मैं उर्दू अंग्रेजी दोनों में गुफ्तगू कर सकूं. तो हुकूमत वो कौन से इक़दाम उठा रही है इन हेल्थ की इनइक्वालिटीज को? What are the learnings जो आपने सेहत सहूलत प्रोग्राम अभी लॉन्च किया है, इससे हमें क्या स्पार्क मिलते हैं? What are the learnings of this? And finally, how are families being supported with this holistic care of maternal and maternal health and nutrition? Make sense, sir? Over to you.
Thank you, Dr. Aziz Saab, Honorable Madam Alvi, my colleague at WHO, Dr. Pleeta, Dr. Rehana, and you being the chief host, Dr. Aziz. So I'm honored to be here with you and just to share a few views from the government side. And taking your questions, कि जी हुकूमत पाकिस्तान क्या कर रही है सेहत की सहूलतों के लिए बराबरी के साथ या मुसावात के साथ? How fair is government? How government is thinking to deliver the similar kind of services without any discrimination to every single segment of our society? Let me give you a little background to our program, and then I'll come to the general health side, how our ministry and government of Pakistan fought against this COVID-19 also. I will share very briefly with you in the end. A few years ago, starting from the KP, Khyber Pakhtunkhwa, this program was started, the Sehat Sahulat program. The vision was कि हम कम से कम पाकिस्तानी आवाम को और उन पिसे हुए तबकात को जिनके पास सुबह खाने के बाद शाम को खाने का पता नहीं होता, उन लोगों के लिए सेहत की ऐसी सहूलियात मुहैया करें जो कि सिर्फ एलीट क्लास ड्रीम कर सकती है पाकिस्तान में. हमारे गरीब तबकात पब्लिक सेक्टर हॉस्पिटल में या बहुत ही निचले दर्जे के प्राइवेट सेक्टर हॉस्पिटल्स में जा पाते थे. मैं एक छोटी सी मिसाल दूं कि कल सुबह 3 बजे अगर खुदा ना खास्ता मेरे या आपके किसी के खानदान को किसी इनपेशेंट इंटरवेंशन की जरूरत पेश आए, and not thousands, lakhs of rupees will be required, चंद लाख, 5, 7, 8 लाख कार्डिक बाईपास, कैंसर या किसी भी इशू के लिए चाहिए, तो कितने लोग हैं पाकिस्तान में जो ये अफोर्ड कर सकते हैं? पिछले दिनों मैं स्टेट बैंक के सीनियर ऑफिशियल्स के साथ एक मीटिंग में था. वो कहने लगे, अरशद साहब क्या आप जानते हैं कि पाकिस्तान में कितनी इनकम इनइक्वालिटीज हैं? I responded, या जितना मीडिया से मुझे पता चल सकता है उतना ही पता है, but I would like to know from the horse's mouth. And they said, very sadly informed me, अर्शद साहब 99% पाकिस्तान की आबादी हजारों में कमाती है. only 0.8% or something, those earn 100,000 or above per month. 93% less than 30,000 and 62% less than 10,000. अब इस किस्म की आमदनी के साथ, with the financial situation going on not in our country but in the rest of the globe as well, in the COVID-19 backdrop. Now you can imagine if tomorrow at 3 a.m. somebody needs few 100,000, forget about few 100,000, only few thousands like 40,000, 50,000, 70,000, from where he can arrange? फिर क्या होता है? देखिए, इनकम इनइक्वालिटीज दुनिया के हर माशरे में, यूरोप से लेके अमेरिका तक, स्कैंडिनेवियन नेशन से लेके चाइना। अगर किसी की आमदनी कम है तो डॉक्टर साहब वो क्या करता है? छोटे घर में रह लेता है, छोटी गाड़ी या बाइक इस्तेमाल कर लेता है, साइकिल या ऑन फीट अपनी जिंदगी चला लेता है, 4 रोटियों के बजाय 2 रोटी खा लेता है, बच्चों को 2 खिलौनों के बजाय 1 खिलौना दिला देता है। लेकिन खुदा ना खास्ता अगर किसी का प्यारा जिंदगी और मौत की कश्मकश में हो तो वो पहले अपना घर बेचने पे राजी होता है, अपनी सेविंग खर्च करने पे राजी होता है, अपने जानवर बेचने पे राजी होता है, अपनी गाड़ी बेचने पे राजी होता है, अपना जेवर बेचने पे राजी होता है। बट स्टिल देयर आर ओनली 50% चांस कि उनका प्यारा सर्वाइव करे। But in both the cases, let me say, the family fall down below the poverty line for next 4 generations. Considering this miserable situation as a ground reality for a 5th largest nation of the world, more than 234 million people today, if I count. तो इस बैकड्रॉप में इस प्रोग्राम को शुरू किया गया, सेहत सहूलत प्रोग्राम, कि हम पहले मरहले पे ये करते हैं कि इंडोर केयर हेल्थ सर्विसेज, हॉस्पिटल के इलाज की सहूलियात वो कम से कम गरीब आदमी को फ्री ऑफ कॉस्ट मुहैया की जाए। विद दिस विजन, इस मुसीबत, इस बला के आगे बांधने के लिए इस सेहत सहूलत प्रोग्राम को शुरू किया गया कि वी प्रोवाइड ए कैशलेस ट्रीटमेंट टू ऑल द पुअर सेगमेंट्स। They can get the card, they can go to any of the 450 plus panel hospitals across Pakistan, right from Karachi to Gawad, cashless. And you will be amazed to know that 90% of these panel hospitals are from private sector. क्यों? कि मुझे और पाकिस्तान की हुकूमत को इंश्योर करना था कि पाकिस्तान के उन अवाम को जिन्हें सेहत कार्ड दिया जा रहा है, they should get honorable, respectable, effective service delivery at their doorstep. Gradually now we are transforming our public sector hospitals as well to enable them to deliver a good service with a very professional customer servicing attitude. But it's a very gradual process, let me be very honest with you. So currently we are providing indoor healthcare services, both secondary and tertiary care. Except transplants and implants, every single disease is being covered. And we ensure, irrespective of our health insurance financial limits, no Pakistani patient should get out of the hospital without completion of the treatment, whether it's the dialysis, whether it's cancer, whether it's cardiac bypass or anything else under the blue sky. तो पहले मरहले पे हमने इस टर्शरी केयर प्रोग्राम का और सेकेंडरी केयर प्रोग्राम का आगाज किया। और आज I would not tell you some very imaginary stories. Let me tell you, last week I was in a hospital due to some family procedure in one of the Islamabad hospital, and just beside me, I visited my own beneficiary patients as well. They are getting the same facility, cashless, and you can see their class, you can see their situation, but सबको जो बेस्ट प्राइवेट पेशेंट्स वहां लेटे हुए थे या जो सेहत कार्ड के बेनिफिशियरीज थे, they were getting the same facility from the same doctors and from the same services and from the same hospitals. इसलिए हम कहते हैं कि fairer and healthier Pakistan. Whether it's a 22 grade officer, whether it's a common person, he should get the same level of treatment from same level of hospital panels. सेहत सबके लिए। तो जब चंद साल पहले शुरू किया गया तो सिर्फ $2 से कम कमाने वाले 32.5 PMT स्कोर से नीचे वाले तबके के लिए शुरू किया गया था, which is at that time, अगर मैं 2010-11 के BIS पे सर्वे से जायजा लूं, तकरीबन 35% पाकिस्तान की आबादी आज के हिसाब से कवर होती है, उसके हिसाब से 55% आबादी कवर होती थी। तो 55% आबादी के लिए ये प्रोग्राम शुरू किया। बाद में वजीर आजम पाकिस्तान ने एक कदम और आगे बढ़ाते हुए फॉर द डिसेबल्ड पॉपुलेशंस, प्राइम मिनिस्टर सेड कि disabled people should also be provided health card irrespective of their poverty level. So we added up, Madam Alvi knows, she is very close to this disability cause, कि हमने disabled पाकिस्तान में जितने भी हैं उन सब के लिए health card का इजरा किया. And he then moved further. Then Prime Minister issued directives कि जी आप ऐसा करें कि जो transgender communities हैं, vulnerable and ignored segment of our society, उन्हें भी सबको ये कार्ड इशू करें। अगरचे हमारे प्रोग्राम का मॉडल ये है कि विफाकी इलाकों के लिए और सूबाई इदारों के लिए फाइनेंशियल कॉस्ट बेयर करते हैं इस प्रोग्राम की, लेकिन इन इनिशिएटिव्स के लिए वजीर आजम पाकिस्तान की खुसूसी हिदायत पर विफाकी हुकूमत ये तमाम फाइनेंशियल कॉस्ट बेयर कर रही। उसके बाद आपको याद होगा पिछले 2-4 सालों में मीडिया पे बहुत ज्यादा हाईलाइट हो रहा था थरपारकर, जो किड्स की फर्टिलिटीज वहां हो रही थी। प्राइम मिनिस्टर टुक अगेन द नोटिस एंड ही सेड कि ऑल्दो कि अभी इस वक्त गवर्नमेंट इस प्रोग्राम का हिस्सा नहीं थी उस वक्त, तो आप ऐसा करें थरपारकर में वफाकी हुकूमत के अखराजात से ये प्रोग्राम शुरू करें। एंड ही टुक ए revolutionary step further. He said, listen, not only for poor people, but for every single citizen of Tharparkar district. तो यूनिवर्सल हेल्थ इंश्योरेंस कवरेज का आगाज थरपारकर से, जहां 100% आबादी, साबिक वजीर आला लास्ट मंथ साबिक वजीर आला अरबाब रहीम was traveling with me from flight from Karachi to Islamabad, and he said, Arshad, am I also covered? I said, yes. He said, I have enough resources, but I said, चूंकि हमने कोई डिस्क्रिमिनेशन नहीं रखी, तो every single citizen is covered, whether you are ex-chief minister or a common thari, all are equal in the eyes of Hukumat of Pakistan. Then, when it comes to the merger of FATA districts, again Prime Minister issued instructions. He said, please give health card to every single FATA citizen, comprising of 7 agencies and 6 districts, 13 districts in total. Then last year, 2020, right in the middle of this pandemic, COVID-19, he issued the instruction to provide health card to every single AJK resident. Now, Azad Jammu and Kashmir, Tharparkar district, FATA, and KP, the whole province, is enjoying every single Pakistani, right from the chief minister to the very common man, a universal health insurance card, Qomi Sehat card. तो सेहत सबके लिए जो हमारा स्लोगन है, we have implemented on ground. Now, Prime Minister has issued last week as summary approval for the ICT and Gilgit-Baltistan, and he already given us instruction about the Punjab as well. So by the year end 2021, all these people will also be covered under the Qomi Sehat card, and every single person. Punjab agar 12.5 crore लोगों का सूबा है, 10th largest country if I count Punjab in global population ranking. So every single one, whether it's GB, AJK, Punjab, everybody will be getting this health card. तो सेहत सबके लिए है। हुकूमत पाकिस्तान का न सिर्फ ये विजन है, न सिर्फ मोटो है, इससे पहले हमारा स्लोगन था सेहत का इंसाफ. It is the same message we are taking forward. Like Qomi Shanakhti card, every Pakistani should have a Qomi Sehat card, where he can sleep very peacefully in night. कल सुबह खुदा ना खास्ता किसी को कोई सेहत की जरूरत पेश आई, तो he will not see his pocket for money. He just get the health card or his Qomi Shanakhti card, and he can go to any of the panel hospital, get the cashless treatment, and go home. This kind of facilities with more than 234 million population nation is a unique thing for not only for this region, but for the rest of the world as well. We are very proud being a normal Pakistani that we have started this initiative. I will say a few sentences with regard to the COVID. Ministry of Health, Government of Pakistan, when faced this unique kind of strange COVID-19 phenomena. It's a unique animal. Nobody can predict anything about it. And it's giving surprises every single day. The unique thing we adopted this time was the Government of Pakistan, both from the military side and both from the civilian side, merged into NCOC model, where both sides sit together, formulated the policies, and they were successfully implemented Pakistan's strive or fight against the COVID-19. And so far, we are in the top 10 better countries in fighting this war against the COVID-19. So I just want to also thank you, Mr. Palita and WHO, that every single step they are with us, not only for the OPD of the WHO OPD pilot project, but for the all other initiatives as well. Here I stop.
Thank you. Thank you very much, Asaf, for highlighting the efforts of Government of Pakistan, which is serious measures taken. However, there are a couple of areas. A very interesting point was mentioned by Dr. Palita, that they have seen and used e-health and telemedicine very successfully. So if you could very short, briefly tell us if there are any digitalization or innovations being used. And second point that I wanted to ask is that, as you are aware, that 70% of the ailments do not require hospitalization or admissions. And 70% of the population goes to the private sector. So is there any plan to improve the OPD, which is the greatest chunk, खांसी, नज़ला, जुकाम, टाइफॉइड, डायरिया, उन चीज़ों के लिए? और दूसरा ये कि क्या हुकूमत इसको प्राइवेट सेक्टर के सर्विस प्रोवाइडर्स को ओपीडी कवरेज के लिए भी कंसीडर करेगी या नहीं? वेरी ब्रीफली
जी, थैंक यू डॉक्टर साहब। मैं आपको दूसरे सवाल का पहले जवाब देता हूं और पहले सवाल का बाद में जवाब देता हूं। गुजारिश ये है कि एज डॉक्टर पलीता मेंशन इन हिज रिमार्क्स that Government of Pakistan already conducting with the help of private sector a very controlled case pilot project in Islamabad few union councils just to get test कि जी OPD जो है किस तरह से include किया जा सकता है। We have seen Iran model, we have seen Thailand model, we have seen Indian model, we have seen Chile model, and now we are trying to test all these multiple options, which one is the best for our society or our market. Currently, we are going for a capitation model where the private sector providers will be providing services to a specific number of families on a capitation fee on annual basis. So we hope कि इस एक साल के project के बाद we'll be in position to see how are the results and what will be the best way to include OPD either through Said Sahulat program or through running a parallel initiative for the OPD. But definitely, tertiary care, we always say in healthcare, if you invest $1 wisely at the primary healthcare, you can save $10 at a secondary and tertiary. So we already have financial challenges when I see my pocket in terms of spending this kind of humongous program for a nation like Pakistan. Definitely, we're don't only focusing the primary health or OPD side, but also on the prevention side, as highlighted by Dr. Palita in his remarks as well. Now comes to your first question. Digitalization. Yeah, digitalization is the way forward. There are many, many remote areas जहाँ पे access नहीं है, ना OPD services का, ना secondary services का, ना tertiary services का. Unfortunately, जब हम ये अपना कौमी सेहत कार्ड को एक्सपेंड करने की बात करते हैं, किसी भी इलाके में एक्सपेंड करते हैं, we are looking for the hospitals. But unfortunately, I just wish to give an example of KP. After Peshawar and half of the Abbottabad, there is no hub in the whole of KP where we can find a good healthcare facility to provide the tertiary care or even a good secondary care. If you see the South Punjab, we have a scarcity of a good facilities, but this is the strange but very known reality to each of us. But let me tell you the brighter side of this as well. When we started 5 years ago, this program in FATA, people were a little skeptical, especially जो hospitals वगैरह थे, वो कहने लगे यार हुकूमत पाकिस्तान शुरू कर रही है, पता नहीं प्रोग्राम कैसा चलेगा, क्या हमें इंश्योरेंस के क्लेम मिल पाएंगे कि नहीं मिल पाएंगे. But when after 6 months or a year, when they saw, oh my God, these hospitals are making money, जो पैनल पर हैं, वो सर्विस भी दे रहे हैं, उन्हें क्लेम भी मिल रहे हैं, then they realize, oh, they are missing an opportunity trend for themselves. More than 30% private sector facilities were grown in the area. So same is going to happen in Balochistan, Sindh, and other far-flung areas. और जहां पर टर्शियरी केयर सेकेंडरी केयर के अलावा हमने ओपीडी या प्रिवेंशन साइड पे काम करना है, दिस नो टू ओपिनियन कि हम टेलीमेडिसिन को भी लेकर आ रहे हैं, उसके पायलट प्रोजेक्ट चल रहे हैं डिफरेंट एरियाज में, हम डिजिटलाइजेशन भी कर रहे हैं. जस्ट टू गिव यू वन थिंग वेरी स्मॉल, इन पब्लिक हेल्थ, whenever we develop at government of Pakistan or any government develop a public health policy, how they can do without digitalization or how they can do without data. If you come sometime to my office, you will see a huge wall where I can see every single patient admitted across Pakistan. And I can tell you every single day how many patients are admitted for what. So if I see in Chaghi area, the remotest area of the Balochistan, that for last 1 week, a particular disease is popping up, I can advise my public health team to look around what is happening there before it gets worse. So similar initiatives, I think, will be very helpful. Thank you very much.
Thank you very much. I think, you know, what really excited me to come with another question was Dr. Palita's, you know, comprehensive review. And probably at some other time, we will also say that it has to go medical literacy, health and education, unless combined together, is highly unlikely to. Now, excuse me, let me come to my third speaker, Dr. Rehana Ahmed. Dr. Saiba. Dr. Rehana is the founder of Social Franchise Network System in Pakistan. We just heard that 70% of the people go to the private sector. So Dr. Rehana comes from the private sector. She has designed and set up this service delivery channels, which is known as Sub-Sitara Network. And madam, if you remember in your breast cancer campaign, 7,000 Sub-Sitara service providers networks were engaged. And I'm very happy to report today that as we speak, the health week is continuing and those Sub-Sitara are still working on the breast cancer is a completely definite menu of their services that they will be offering at these. So thank you very much for motivating us. Dr. Rehana is the current chair of the Greenstar Social Marketing. She is also on the boards of PSI and PSI Kenya. She has the Pakistan Corporate Governance Certification of Directors. She's also a member of World Health Organization Reproductive Health Scientific and Technical Advisory Group till 2022. Dr. Saiba, welcome to this panel. My questions will be twofold. How has Greenstar contributed over the years for improving the health access with its network across Pakistan? What more can be done? We have heard the international perspective. We have heard the government perspective. The private sector story. Over to you, madam.
Assalamu alaikum. First of all, assalamu alaikum to the First Lady for joining us in this Greenstar event, which Dr. Rab is facilitating very efficiently and actively, and WHO and government representatives. I must say that I still haven't got over the figure that Dr. Mahapala has told us, that the IMR, the infant mortality rate in Sri Lanka, is 6 per 1,000 live births. I think that is phenomenal. The current Pakistan infant mortality rate is well over 60 per 1,000 live births. So really, I'd like to begin by saying that as we are working towards a fairer and healthier Pakistan, the first data point we need to pick up is the mortality, child mortality under 5. Because how unfair is it that a child should die, and how it shows a lack of progress. And I think in the human terms, if you were to speak to a mother who has lost a child, it is heart-rending. It is a great tragedy. And I think for Pakistan's future, keeping our children alive is most fundamental. Keeping them alive, keeping them healthy, and making them reach their full potential, because they are the future of Pakistan. Now, how do we do that? And obviously, the answer is it's the mother. She has to be looked after. And how is that going to happen? Again, we're talking of health, and in all fairness, she needs that care during her pregnancy, the prenatal, the safe delivery, the postnatal, the breastfeeding, very critical for the child's survival. It is a strategy of child survival. और breastfeeding तो हमारे मजहब में भी है कि 2 साल तक, 2 साल 10 दिन तक, लेकिन अगर दोबारा स्पेसिंग और दोबारा प्रेगनेंसी ना हो और फैमिली प्लानिंग की सहूलत ना हो, तो फिर वो बच्चा जो है उसको ना दूध मिलेगा मुकम्मल और ना ही वो सेहतमंद होगा. तो हमारी जो इन्फेंट मोर्टेलिटी है उसमें 50% तो बच्चा पैदा होने के 28 दिन के अंदर ही अंदर जो है वो फौत हो जाता है. The neonatal mortality is very high, which actually does point and has been proved to be the result of inadequate basic obstetric services, emergency obstetric services, as well as the mother's health and the lack of care for the child. So we cannot talk about a fair health system unless we have our children and our mothers, taken care of. Now, if we look at the health system in Pakistan, or Dr. Rab ne bhi zikr kiya hai, it's been mentioned again by all round, and I think Arshad Saab has mentioned 90% of hospitals where the sehat sahulat is being given is in the private sector. We've heard all that. Well, the actual reality is that the government owns 30% of the healthcare system. 60% is owned by the private sector. That is the reality. And 10% is through philanthropy. That is, again, the reality. Philanthropy is international and domestic both. Now, Greenstar, and I'll talk about Greenstar, is really working across 2 spheres: the philanthropy from the international development partners, as well as the private sector, which Dr. Rab has explained, and Begum Saiba knows about the 7,000 private provider network that we have set up. It's the largest reproductive health network in the world of private providers. Now, having said that, I think the important point is that Greenstar currently, the mission is really to prevent unplanned pregnancy. So prevention is the main focus here. More recently, the board has allowed the mission to be expanded, and we have family health solutions, so that apart from making contraceptives, which again, let me point out, are largely purchased internationally, while we still are wondering how manufacture is going to take place in Pakistan, most of the products are being imported. And these products then, contraceptives, are really then packaged, attractively branded, and distributed across the country through all the number of outlets, large number of outlets Dr. Rupp pointed out, and through the network. The short-term methods, you can get over the counter, you can get in all these outlets. But the long-term methods, which are the highly effective methods, and which is where we should be focusing, we find that you need the private provider. And I often say this, and I'll repeat it, the IUD cannot jump out of the packet into a woman's uterus. It has to be inserted by a trained provider. So the network that Greenstar has set up, we don't own any of the clinics. We have trained them to offer the services. And now, in addition, they are being trained in various other maternal services. They are being supported through the contraceptives that are sold to them. And these are affordable. The reason is, again, the development partners who have financed Greenstar, and you can subsidize these products. Having said that, we talk of availability, accessibility, affordability. Well, really, in this day and age, the tools for preventing pregnancy are well known. They are readily available to most people, except here we find that women are not using them or not able to access them. The result is they do turn to abortion. And no woman should have to undergo an abortion because prevention is now well known and very effective. So if it is not available to her, or if she goes into the 3 phases of unmet need, the 3 phases of unmet need is a Population Council research paper, which says that the first phase is that she has a religious doubt. Can I use it or can I not? So the idea of family planning has not been sold well. That has not been accepted well. So it is a failure in many ways of how we've communicated to our people. The second phase is when you have all the discontinuation. You know, it's like a leaky bucket. You keep bringing people in for contraception, and then they have the quality of care is missing. And when the quality of care is not there, the woman discontinues the method, and then you can never bring her back into that pool of women using contraception. So I think it's very critical to realize that we cannot talk about a large and fair and healthy network of healthcare unless we also talk about the quality of care. And we in Greenstar have done that by training these providers, not just technically, that they must do to be able to join the network, but we have imparted skills, and the skills are in counseling, the skills are in infection prevention. I think these are critical points. And by doing this, what we've done is that we have improved the private health sector that we touch by improving the quality of the overall practice. If you can prevent infection in a clinic, and if you can counsel the clients, whether they be for family planning or any other disease, counseling is the same. The methodology is usually the same. So we have done that. And therefore, I think it's very important to be recognized for this work which we have done. And at the same time, it is also very critical that the government utilize this kind of business model that has been put together. The government should be turning towards NGOs like Greenstar, recognizing the work that they have done. And they, if I may say this, and I say it, I'm hoping Arshad Saab will take it back, that they must have a partner. Government cannot go to each and every clinic, small scale clinics, where again, as Dr. Rupp said, 70% 70% औरतें हमारी जाती हैं ये छोटी क्लिनिक्स में। अब गवर्नमेंट एक एक क्लिनिक में तो नहीं जा सकती ना उसको देखने के लिए, तो फिर हमें पार्टनर बनाए ना, ताकि हम इंश्योर करें कि इन क्लिनिक्स में काम सही हो, प्रोवाइडर्स ट्रेंड हो, क्वालिटी सर्विस दें। देखिए, इसके बगैर काम नहीं चलेगा। वेलफेयर स्टेट, great, we must be a welfare state, but that is many decades away. What happens now? What happens? We have to use the current available resources to the maximum. And that is where I think we have to focus. Now, I applaud the government for having taken care of catastrophic disease. I think that's really commendable and that should go on. But then when you start thinking of primary care and you think of prevention, at उस वक्त जो है फिर आप पार्टनरशिप्स बनाएं, और किसके साथ बनाएं? जिन्होंने 30 साल से आपको प्रूव करके दिखा दिया है, और डोनर्स जो हैं वो बार बार हमारे पास आ रहे हैं, तो फिर गवर्नमेंट क्यों नहीं आ रही? Why? What is the hurdle? What is stopping them? And when we talk to them, they say, what is social marketing? Well, it's a business model. What is franchising? It's a business model. Why? Because we work with the private sector and they understand business. So I think it's very important that this message be taken back to the government. I just want to close, because I'm sure we're running out of time, that what Melinda Gates has said, that the importance of family planning is so great that until and unless, and I repeat, until and unless Pakistan does not achieve its family planning goal, it will not achieve any other sustainable development goal. So family planning is at the core of it. If we can contain our numbers, we can educate, we can do everything. But if we don't contain and look after our children, keep them alive, and keep our mothers healthy, I think everything else is going to dissolve into nothing. And welfare state is great, but it's a long way away. So let's be realistic. Thank you.
Thank you very much, Dr. Rihanna. I think Dr. Palitha had very nicely phrased that unless and until we educate and provide, have a plan. And secondly, what we heard from Dr. Rihanna is that government may not have the resources despite all the good wishes. So private sector service provider network is already a low-hanging fruit. If it is sponsored, supported, and regulated by the government, they will be the first-line warriors to do their job for them in the community. Okay, thank you, Dr. Rihanna. Thank you very much. Ladies and gentlemen, all those people out there on Facebook, now I would request our Honorable First Lady, Madam Samina Alvi. Madam, we are extremely honored that you are here with us. It is for the first time in 70 years, and I keep on reiterating it, that so much energy is radiating, exuding from the presidency in Pakistan. You have driven it so very beautifully, and we are again happy to report that what you started with breast cancer awareness campaign, service, Greenstar board has enlarged its mandate, and we are now going beyond the breast cancer. Every service provider, whether it is a GP or LHP, are going to be focused for transforming into a universal healthcare coverage and primary self-care. So because it is around primary care that first line defense. Madam, you have been extremely vocal about the advocate of improving women's access. औरतों को रसाई दी जाए breast cancer में, वो लोग जिनमें disability होती हैं, क्योंकि इस वक्त पूरा पाकिस्तान आपको सुन रहा है. आप अगर उर्दू में खिताब फरमाएंगी तो हमारे बहुत सारे सर्विस प्रोवाइडर जो इस वक्त लाइन पे हैं वो भी मुस्तफीज हो सकते हैं. आपने पर्सनली इन्वॉल्व हुई हैं एडवोकेसी करने में टू एक्शन ऑन ग्राउंड. सो व्हाट हैज इंस्पायर्ड योर जर्नी एंड व्हाट आर सम ऑफ द की गाइडलाइंस आप हमें देना चाहेंगी वो हमारी रहनुमाई के लिए to both public and the private sector, because we have the government here as well, to reduce health inequalities, particularly ख़वातीन और बच्चों की सेहत के बारे में। Over to you, madam.
Assalamualaikum. All the participants, thank you for inviting me and for setting this platform. My journey started off years ago when I started involving myself in charities. I saw many women in villages who worked because their husbands, fathers were into drugs or alcohol. These women, however, were not able to get their own proper health care. You all know that 50% of our population are females. Medicines and treatment is expensive all over the world. As you know, कि पाकिस्तान एक डेवलपिंग कंट्री है और हमारी ख़वातीन की आबादी तकरीबन 10 करोड़ है और इनको मेडिकल फैसिलिटीज तक रसाई और इलाज का महंगा होना जैसे मसाइल का सामना है। मैं खुद डॉक्टर तो नहीं हूँ, मगर मैंने पाकिस्तान में मेडिकल के हवाले से मसाइल को बहुत करीब से देखा है। स्पेशली मैंने अपने माशरे की अंडर प्रिविलेज क्लास की ख़वातीन को सेहत की बुनियादी सहूलियात से महरूम देखा, जिसमें मैं हर तरह की महरूमी को एहसास किया कि हमारे रूरल एरियाज की ख़वातीन न सिर्फ बुनियादी सहूलतों से महरूम हैं, बल्कि इनको अवेयरनेस भी नहीं है। महज यही नहीं, हमारी सोसाइटी की बहुत सारी ख़वातीन तमाम सहूलतें मैसर होने के बावजूद खुद को नज़रअंदाज करती हैं और अपनी किसी भी फिजिकल कॉम्प्लिकेशन को अपनी फैमिली से शेयर करते हुए हेजिटेट करती हैं, जिसका नतीजा ये होता है कि सारी फैमिली उससे मुतासिर होती है। इसके अलावा मैंने ख़वातीन की सेहत और बिलखुसूस ब्रेस्ट कैंसर पर फोकस करने का सोचा। अभी जैसे डॉक्टर अरशद ने फरमाया और मुझे सुनकर और ये सब मालूम होते हुए बहुत खुशी होती है कि गवर्नमेंट हेल्थ पे बहुत काम कर रही है और ये मेरा ख्याल हमें ये मैसेज को बहुत वायरल करना चाहिए कि लोगों को सबको ये बात का इल्म हो कि कैसे क्या कर रही, क्योंकि बहुत सारे लोग हैं जिस इस प्रोग्राम से अवेयर नहीं भी हैं। तो मैं आपके प्लेटफॉर्म के ज़रिए ये लोगों तक मैसेज पहुंचाने की कोशिश करें, हम सब मिलकर, कि ये गवर्नमेंट इस पे काम भी कर रही है। और जहाँ तक डॉक्टर रेहाना ने बताया अबाउट फैमिली प्लानिंग, उस पे भी इस ऑफिस से काफ़ी काम हो रहा है अबाउट द ब्रेस्ट कैंसर एंड फीडिंग। इन सब चीज़ों पर बहुत ज़्यादा हम इस पर अहमियत दे रहे हैं और इंशाल्लाह करते रहेंगे। मैंने अभी फ़िलहाल ब्रेस्ट कैंसर पे शुरू में फोकस किया कि हमारी बहनों में इसकी अवेयरनेस नहीं है और एक बहुत बड़ा टाबू समझती हैं इसको डिस्कस करने के लिए। इसका बर वक्त इलाज ना कराने और सेहत की नाकाफ़ी सहूलियात की वजह से मौत के मुंह में चली जाती हैं। आप सबको मालूम है दुनिया में 99-98% रिकवरी है बिकॉज ऑफ लैक ऑफ अवेयरनेस। हमारे यहाँ 40-45% डेथ रेट है। ख़वातीन के हुकूक, इनकी सेहत, इनकी माशी खुशहाली और खुसूसन ब्रेस्ट कैंसर के हवाले से अवेयरनेस पैदा करने का बेड़ा मैंने उठाने की कोशिश करी और इस सिलसिले में हमें काफ़ी हद तक कामयाबी भी मिली। In this case, I want to thank Greenstar and WHO for their support. We also wanted WHO, Greenstar, and other civil societies to focus on some other issues as well as the cause of persons with disabilities and street children. We need to educate them and try to give them a respectable living. I know that this platform is working on health, मगर हमारा कुछ इसके जरिए मेरा ख्याल है कि इसकी अवेयरनेस भी होना चाहिए। कि बच्चों के, जैसे डॉक्टर रेहाना कह रही हैं कि इतने डेथ रेट है अंडर 5 या 2 years में, तो इनके लिए भी हमें कुछ काम करना चाहिए अबाउट स्ट्रीट चिल्ड्रन। अब हमारी कोशिश है कि हमारे माशरे में न सिर्फ ख़वातीन बल्कि पर्सन विद डिसेबिलिटीज के हुकूक को भी एहसास पैदा किया जाए और माशरे के इन नज़रअंदाज किए जाने वाले तबक़ात को इनके हुकूक दिलाए जाए। इस मकसद के लिए मैं हुकूमत और निजी शोबों से दरख्वास्त करूंगी कि वो मुल्क में ख़वातीन और बच्चों की सेहत और तालीम के लिए इक़दामात करें। हमें सेहत की सहूलियात ख़वातीन तक पहुँचाने के लिए इन सहूलियात को ईजी एंड एक्सेसिबल बनाना होगा। हमें ख़वातीन के मसाइल पर लोगों में आगाही पैदा करना होगी और इन मसाइल का एहसास जगाना होगा। मैं हुकूमत, मीडिया, उलमा और माशरे के तमाम तबक़ात से ताल्लुक़ रखने वाले लोगों से दरख्वास्त करूंगी कि वो हमारे माशरे में ख़वातीन को दरपेश चैलेंजेस, उनके हुकूक की तहफ़्फ़ुज़ और पर्सन विद डिसेबिलिटीज़ एंड स्ट्रीट चिल्ड्रन के मसाइल के बारे में आगाही और उनके हुकूक की फरहमी के लिए इक़दामात करें। मुझे यकीन है कि हमारे मुश्तरका काविशों से ख़वातीन और पर्सन विद डिसेबिलिटी की ज़िंदगियों में मस्बत तब्दीली आएगी। मैंने कुछ थोड़े से पॉइंट्स इस बात में भी लिखे हैं। मैं चाहती हूँ कि हम लोगों का मेडिकल डेटा अच्छा होना चाहिए। मैं WHO एंड यहाँ पर इस वक्त गवर्नमेंट के वो बैठे हुए हैं डॉक्टर अरशद साहब, उनसे ये रिक्वेस्ट करूँगी कि डेटा फैसिलिटीज़ बहुत ज़रूरी है। मैंने जब से ब्रेस्ट कैंसर का शुरू किया था उस वक्त से मैं उसके ऊपर भी काम कर रही हूँ कि हमें डेटा होना चाहिए हमारे पास। वी हैव नो डेटा, आई थिंक, एज फार एज आई नो, मेरा ख्याल हमारे पास कंप्लीट डेटा नहीं है। और दूसरे, ये पर्सन विद डिसेबिलिटी का भी हमारे पास डेटा नहीं है। इसके लिए मैं डॉक्टर फैसल सुल्तान, हेल्थ मिनिस्टर, उनसे भी काफ़ी कोशिश हो रही है कि इसमें 1 विंडो करें। 1 विंडो मीन्स कि उसमें मेडिकल एंड ID कार्ड नादरा भी साथ हो और उनको जितनी हम सहूलत दे सकते हैं दें, उनको एक वक्त में कार्ड बनाएं। प्राइम मिनिस्टर साहब ने एक, जैसा आपने बताया कि सहूलत कार्ड फॉर पर्सन विद डिसेबिलिटी के लिए भी दिया है, बट अनफॉर्चुनेटली हमारे पास डेटा नहीं है। तो इसलिए हमें चाहिए कि हम इस पे, बहुत ज़रूरी है कि प्लीज़ इस पे काम हो। मैं कंटिन्यूसली ये बात को अहमियत दिलाना चाहती हूँ कि आप लोग पर्सन विद डिसेबिलिटी के लिए एक 1 विंडो का काम करें और ताकि उनको सहूलत दी जाए, उनके जो फैसिलिटीज़ हैं, उन पे जो काम हो रहा है, उनको वो मैसर हो सके। तो आप लोगों से सबसे यही सब मेरी रिक्वेस्ट है कि हम सब मिलकर इंशाल्लाह इस पे काम करेंगे और इंशाल्लाह अच्छी तब्दीलियां लेकर आएंगे पाकिस्तान में। बहुत शुक्रिया आप सबका।
Thank you very much, madam. We are really inspired. Let me give you my assurance, madam, कि Greenstar Social Marketing के 7,000 सर्विस प्रोवाइडर्स के नेटवर्क पे आज के बाद मैंडेटरी है। वैसे पिछले 30 सालों से हर महीने डेटा पाकिस्तान ब्यूरो ऑफ स्टैटिस्टिक्स जाता है और अगर ना जाए तो वहां से फोन आ जाता है कि जनाब आपका इस महीने की परफॉर्मेंस क्या रही है। तो कम से कम ये नेटवर्क के 7,000 का डेटा बी एश्योर यू कि चारों प्रोविंसेस और पाकिस्तान ब्यूरो ऑफ स्टैटिस्टिक्स को पहुंचे। और होलिस्टिक केयर ऑफ द फैमिली में हर सब सितारा की नेटवर्क आपके लिए हाजिर है कि इसमें माँ बच्चे की सेहत, डिसेबिलिटी में हुकूमत हर जगह नहीं जा सकती। मोहल्ले में मौजूद वो सर्विस प्रोवाइडर जानती है कि किस किस घर में किस तरह की माजूरी के साथ लोग रह रहे हैं। सो मैडम, इस होलिस्टिक केयर में उसको भी शामिल किया जाएगा। और प्राइमरी केयर के साथ साथ ये जो आपने बताया कि जो अवेयरनेस क्रिएट करनी है, ये स्ट्रीट चिल्ड्रन, और इसमें भी हमने एक प्रोग्राम शुरू किया है जिसको सोशल एंटरप्रेन्योरशिप प्रोग्राम है। इसमें इन सर्विस प्रोवाइडर्स को बिजनेस उसूल सिखाए जा रहे हैं और उसमें हम उनके मोहल्ले के लड़कों को और बच्चियों को भी रोजगार फलाहमी के लिए इस हेल्थ नेटवर्क में इंगेज करेंगे एज कम्युनिटी मोबिलाइजर्स। इसकी डिटेल हम आप तक पहुंचाएंगे। In the end, madam, very quickly, in one sentence, because it was a perfect beginning, Dr. Palita, if you kindly, in one sentence, what would be that parting, advice to us in Pakistan, because you have been here, you're a well-wisher of Pakistan. If there was one thing that you would like to reiterate, what would that be? And I would really request all my speakers, one-liner, parting message.
Thank you so much. After listening to the Honorable First Lady, I was thinking what to tell. It is so amazing to hear the commitment from the highest level, leading the whole thing at the highest level of the government. So what we need to do is commit ourselves individually and collectively. And I'm sure Pakistan is very much on the track. So much of commitment for primary health care, for universal health coverage, and so much of commitment to marginalized group. Then so much of commitment to improve the care for disabled people. So there's so much of stars aligning together at this moment to move the health agenda forward. I think this is the best time to commit ourselves and work together, all the partners, all the agencies, government together, and move forward. I'm sure in few years' time, this is a different country. I am very much happy and impressed about the excellent discussion today, and I'm very much happy about the commitment from the First Lady herself. That's very inspiring. Thank you so much for inviting me to join this wonderful, great event. Thank you.
Thank you, Dr. Palita. We stand tall when we are with you. Dr. Ashraf Saab, aap kuch farmaiye, one parting line very quickly. I would really appreciate it.
Sure, मैं एक गुजारिश करना चाहूँगा मैडम अलवी की खिदमत में कि जहाँ जहाँ अब प्रोग्राम जो है यूनिवर्सल हो गया है, उस साल के आखिर तक पंजाब आईसीटी और गिलगित बल्तिस्तान में भी हो जाएगा, तो नो मोर स्पेशलाइज्ड पीडब्ल्यूडी कार्ड्स आर रिक्वायर्ड. अब हर वो शख्स जो डिसेबल हो या नॉन डिसेबल हो, जिसके पास सिर्फ कौमी शनाख्ती कार्ड हो, उसे हेल्थ कार्ड दे दिया जाएगा. दिस नाउ फॉर्मेलिटी इज बीइंग एलिमिनेटेड on your direction and on your support. And one last thing about Dr. Rehana, जी दो चीजें, एक तो ये कि हमने जो सेहत सहूलत का जो मैटरनिटी पैकेज बनाया है, उसमें फैमिली प्लानिंग और वैक्सीनेशन बच्चों की और फैमिली प्लानिंग की काउंसलिंग को पार्ट बनाया है विद एंटीनेटल केयर एंड पोस्टनेटल केयर, जस्ट टू गिव स्पेशल एम्फेसिस विद द चाइल्ड एंड मदर मोर्टेलिटी साइड और हेल्थ साइड. जो पायलट इस वक्त हम कर रहे हैं विद द हेल्प ऑफ डॉक्टर पलीता, उसमें भी ज्यादा फोकस जो है वो प्राइवेट सेक्टर प्रोवाइडर्स के साथ है. डेफिनेटली वी लुक फॉरवर्ड फॉर योर सपोर्ट फॉर द फर्दर प्राइमरी हेल्थ केयर आउटरीच. और एक ही मेरा जो है वन लाइनर आखिर में होगा कि सेहत सबके लिए, जहनी भी और जिस्मानी भी.
Thank you very much. Dr. Rehana, very quickly before I ask the last word, what would be that parting? You're mute.
I would again say that a private sector को fully engage करने के लिए ये जो है payment for performance, इसको जरूर financing mechanisms को जरूर सामने रखना पड़ेगा, क्योंकि private sector is a business. And business model does not run without financial incentives. So I think it's very critical to understand what we want and then utilize the incentives that will give us results. Otherwise, we will be wasting our efforts. Thank you.
Madam Alvi, your parting words, advice, really motivational.
शुक्रिया. डॉक्टर अशरफ साहब, मेरा प्रॉब्लम ये है कि पर्सन विद डिसेबिलिटी वालों के पास कार्ड्स नहीं हैं. दे डोंट हैव आईडी कार्ड्स बिकॉज उनके लिए आईडी कार्ड बनाना इज द बिगेस्ट प्रॉब्लम. तो मैं उसको सॉल्व करना चाहती हूँ. अकॉर्डिंग टू नादरा वी हैव ओनली 3%. And according to WHO, we have in Pakistan 10 to 15% with disability. So हमारे पास data ही नहीं है. We don't have data. They don't have ID cards. अगर उनके पास ID cards नहीं होंगे तो वो उनको facilities नहीं मिलेगी. मेरा ये problem है. और मेरी एक लाइन ये है कि we must focus on awareness and prevention. We should all work together, and inshallah, if we'll work together, we will succeed. Thank you so much, and a very good platform, mashallah.
Thank you very much, madam. Dr. Malin Palita, Dr. Arshad, Dr. Rihana, and the First Lady, we are all with you, madam, with the government of Pakistan, and Greenstar Social Marketing will be walking in step with you. So for a healthier Pakistan, we'll drive it, we will try to find a solution. We really thank our panelists and all those people who are listening to us, especially the service providers who are on the Facebook, that they are coming up with us. Thank you very much. Pakistan Zindabad.